At Spectrum Health, we are pleased to provide specialized rooms for natural birthing. Our rooms fall in line with the definition of a birth center from the American Association of Birth Centers, which describes them as a home-like facility existing within the healthcare system with a program of care designed in the wellness model of pregnancy and birth. We recognize that the environment we provide is crucial in promoting natural childbirth. Natural childbirth is a labor and birth free of medical intervention. Providing you with an environment in which you feel safe and supported will allow you to relax, focus, and assist in laboring spontaneously. Our natural birthing rooms are designed to look and feel more like a bedroom than a hospital room. We believe that recognizing and respecting a laboring woman's independent choices and how she wants to labor is an important part of her experience. Our natural birthing rooms are designed for low-risk women in labor. This type of care is supported by medical and nursing research. It shows that limiting the use of interventions, such as IVs, continuous monitoring, and routine use of medication, in low-risk pregnant women can lead to better health for women and babies. The idea of providing the option for a natural childbirth room for our low-risk laboring patients is based upon evidence and passion for promoting natural birth. Current evidence-based practice supports limiting the use of intervention in low-risk pregnant women while supporting a low-risk model of care. This model of care results in improved outcomes in the following areas: decreased cesarean section rates, decreased episiotomy rates, decreased length of hospital stay, increased breastfeeding success, improved birth outcomes, and improved patient satisfaction. To further promote natural birth in our birthing suites, we encourage the following: movement, such as squatting, lunging, rocking, birthing ball use, and slow dancing. Relaxation techniques, such as massage, dim lights, music, and aromatherapy. Hydrotherapy in the shower or whirlpool tub. Hot or cold therapy. Patient-directed pushing. Delayed cord clamping. And skin-to-skin contact immediately following delivery, which promotes bonding and breastfeeding. Now that we have explained what we promote and how we can encourage natural birth, it is also important to discuss the criteria of the natural birthing suites, so you and your provider can decide if this is the right decision for you. You must be pregnant with one baby, and your baby must be in the head-down position. Your provider must approve you to use one of our natural birthing rooms. You must participate in the orientation class, which can be done using this module, attending a class in person, or both. You must be full term, which is between 37 and 42 weeks. Your pregnancy must be low risk. On admission, you must be in active labor. Your vital signs must be normal. Your baby will be monitored in OB triage, and this monitoring must be normal. There are times when mothers may initially qualify to deliver in our natural birthing rooms, but then need to be transferred out. You may need to be transferred to a traditional labor and delivery suite because something has changed in your labor that requires more care. This is for the safety of you and your baby. Rest assured, your provider will discuss this transfer with you and involve you in the decision-making process. The following are a list of possible reasons that you may be transferred to a traditional labor and delivery suite. Your baby shows signs of needing continuous fetal monitoring. You develop abnormal vital signs, such as high blood pressure. You have heavy bleeding. There is meconium in the amniotic fluid. You develop an infection. You decide that you would like an epidural. Your labor stops progressing, or you need additional medications to help your labor progress. If you have any questions or concerns regarding any of these criteria, please contact your provider. The decision to have a natural birth is a very personal decision and may not be for every woman. Anyone considering a natural birth should discuss their options with their physician or nurse midwife. There are also some medical conditions that may require labor and birth to occur in a traditional birthing room due to the need for closer monitoring. You may need a traditional birthing room if you desire an epidural, your water has broken and you are not in labor, you have had pregnancy complications such as diabetes, high blood pressure, preeclampsia, or severe anemia, you are in preterm labor, you have had a previous cesarean section. Other conditions may also be included at the discretion of your certified nurse midwife or physician. Remember to voice any questions or concerns to your provider, as they want to partner with you to provide you with the best possible labor and birth experience in the safest way possible. You are participating in the Natural Birthing Room orientation class right now. Once you have completed this module, your name will be put on a list of our patients desiring care in the natural birthing suites. When you are in labor, your provider will alert the staff in OB triage that you are on your way to the hospital and that you want to use one of our natural birthing rooms. When you arrive at the hospital, you will be evaluated in OB triage and admitted to a room. As long as nothing has changed with you and your pregnancy, we will do our best to ensure that there is a natural birthing room available for you. If a natural birthing room is not available, we are able to offer you a natural labor and birth in our traditional labor and delivery rooms. We are very proud of the staff that we have at Spectrum Health. All of our staff members are more than qualified to meet your natural birthing needs. We want to assure you that the birth center rooms will be staffed by nurses who support you and believe in keeping natural birth a normal process. You will receive continuous one-on-one labor support. We respect and encourage you to use the coping mechanisms that you have practiced with your provider and your partner. In order to help you, you will receive intermittent fetal monitoring once you arrive in the room. You can expect to have routine blood work drawn. We support your decision to have a natural birth. In some cases, such as with women that are GBS positive, medications may be necessary. In these cases, an IV will be started, but we can disconnect it between doses of medications. We also are able to offer you some types of pain medications or nitrous oxide to help you cope with your labor. We encourage you to discuss this with your provider and develop a plan prior to being in labor. After the birth of your baby, you will stay in the natural birthing room for several hours before transferring to a traditional postpartum room, where we will continue to partner and support you. We will encourage a relaxed recovery period after delivery. Because of our baby-friendly designation, all of our nurses and staff have received additional breastfeeding education and are ready and willing to support you to give your baby the best start possible. If you have any questions or concerns regarding the natural birthing rooms at Spectrum Health, please contact your physician or nurse midwife. We hope that you are able to experience the comforts of home and have your baby your way in our natural birthing suite.